Welcome to our channel. Today, we are going to learn how to ask a pharmacist about medicine dosage.
This is going to be super useful. I always get nervous when talking to pharmacists in English. I'm afraid I'll take the wrong amount.
Don't worry, Mark. By the end of this masterclass, you'll be a pro. We'll cover everything from dosage to side effects.
Awesome. Let's dive in.
First, let's clear up two big words, dosage and frequency.
I hear these all the time. Dosage is how much medicine you take, right?
Exactly, like 1 tablet or 5 milligrams, and frequency is how often you take it.
So twice a day is the frequency?
You got it. Confusing these two can be dangerous, so listen carefully to the pharmacist. The most basic question involves the dosage. You need to know the exact number.
So I should ask, how many tablets should I take per day?
Perfect. Or, what is the recommended dosage for this medication?
And if it's not a tablet, it might be a capsule, right?
Yes, always clarify if you are taking 1 tablet, 2 capsules, or something else.
Sometimes pills make my stomach hurt. How do I ask about that?
Great point. You should ask, is it better to take this with food or on an empty stomach?
That's vital. Some medicines need food to absorb properly, right?
Correct. And others might not work if you eat. Always check the timing relative to your meals. Now let's talk about the scary stuff, side effects.
Oh, like getting a headache or feeling nauseous?
Exactly. You can ask, what are the common side effects of this medicine?
It's better to know in advance so I don't panic if I feel dizzy later.
Absolutely. Knowledge is power when it comes to side effects.
What about cough syrup? I usually just grab a spoon from the kitchen.
Oh no, Mark, never do that. Kitchen spoons vary in size. You need a specific measuring spoon.
Oops. So I should ask, should I use a measuring spoon or the cup provided?
Yes, using the correct measuring spoon ensures you get the exact amount. All right, Mark, let's role play. You're the customer, I'm the pharmacist. You have a new prescription for allergies.
Okay, deep breath. Here I go. Hi, I'm here to pick up my prescription for allergies.
Sure. Here's your medicine. Do you have any questions?
Yes. How many tablets should I take and how often?
Take 1 tablet every morning with water.
Wait, allergy medicine often makes me sleepy. I drive a truck for work.
That is a critical safety question. You must ask, will this medicine make me sleepy?
Or does this cause drowsiness?
Exactly. If the answer is yes, you shouldn't drive. Always check before you leave the counter. Do you know the difference between over-the-counter and prescription drugs?
Prescription is when the doctor writes a note, right?
Yes. Over-the-counter, or OTC, means you can buy it off the shelf without a doctor's note.
So for a headache, I usually buy over-the-counter medicine.
Correct. But you can still ask the pharmacist questions about over-the-counter items.
I'm terrible at remembering things. What if I forget to take my pill?
This is a very common question. What should I do if I forget a dose?
Should I take 2 the next day?
Usually, no. That can be dangerous. Never double up unless told. Always ask the pharmacist specifically about missing a dose. When your bottle is empty, you might need a refill.
That means getting more medicine without seeing the doctor again.
Exactly. Ask, how do I request a refill for this prescription?
And sometimes the label says no refills, which means I need to call my doctor.
Precisely. Always check the label for refill status.
I usually just keep everything in the bathroom cabinet. Is that okay?
Not always. Humidity can ruin some meds. You need to ask about storage instructions.
Like, should I keep this in the refrigerator?
Yes, some antibiotics must be cold. Ignoring storage instructions can make the medicine ineffective. Let's do another role play. This time, you are buying medicine for your child.
Got it. Kids need different amounts, right? Hello, I need some cough syrup for my son. He is 6 years old.
Okay, the dosage depends on his weight. How much does he weigh?
He weighs 20 kilograms. Can you show me the correct line on the measuring spoon?
Certainly. Fill it to this line here. The pharmacist isn't the only source of info. You must read the instructions on the box.
The print is so small sometimes.
I know, but look for keywords like caution, directions, or instructions.
If I don't understand the written instructions, I should go back and ask, right?
100%. Never guess. Pharmacists are busy, so being polite helps. Use phrases like, "Could you explain?"
Could you explain how to measure this? Sounds much nicer than tell me how to measure this.
Yes, or would you mind going over the side effects again?
Politeness gets you better answers.
We made it! Let's recap the top 5 essential phrases.
1. How many tablets should I take?
2. Is it better to take this with food?
3. What are the side effects? And 5. Will this make me sleepy? Thanks for the masterclass, Emma.
You're welcome, Mark. Stay healthy, everyone.